Breastfeeding isn't always an easy task, especially when you don't know your baby's nursing behavior. Why isn't he or she latching on? What does it mean when he or she moves her mouth like that? Why won't they just eat already? Do you know that each baby has their own style of feeding? Researchers at Yale University have identified 5 common baby feeding patterns. Do you recognize which style your baby has? Let's check out. In this video we will learn about baby feeding patterns or baby feeding style. Hey there, you lovely ladies. You are watching Women and Baby Care on YouTube. Welcome back to the channel, and if it is your first time, you are welcome, it's pleasure. If you not only wanted to know about women and baby care but also wanted to learn about the various psychological, social and emotional considerations that you need to take care during your pregnancy, then don't miss to hit the subscribe button at the bottom of this video. Number 1. The Barracudas. The Barracudas get right down to business and have no problem in getting started. They waste no time and energetically dive into their feeding sessions. These babies know exactly what they want and can eat like there's no tomorrow. Latching on for 10 to 20 minutes at a time, Barracuda babies grab on pretty tightly and nurse quickly. While it's always great to see your little ones eating and getting strong, this kind of vigorous nursing may cause you pain and bruising. So, make sure to get your baby in a comfortable latch within 2 to 3 suckles or the first minute of feeding. Your baby may be really hungry, but carefully taking little breaks and testing out different positions can help your baby practice latching properly and can save you from some discomfort. Number 2. The excited. These babies get thrilled at the mere sight of the breast. However, their enthusiasm often leads to a cycle of grasping, losing, and, well, a bit of frustration. Although they go into a feeding frenzy as soon as they see you're ready with their next meal, these eager newborns have a level of excitement that can quickly become difficult to control. So they easily lose their latch, get frustrated, and start screaming and crying. Your baby's wild and panicky gulps could also cause them to swallow a lot of air and leave your milk spraying. The key to nourishing this type of baby is feed her or him before he or she gets desperately hungry. Watch out for when they're just waking up, moving their mouth, sucking their hands, or rooting. Then make their comfort your priority. Babies with this nursing personality need to be in a calm environment. So, be sure to bust out some slow rocking movements, skin-to-skin contact, and burping. Number 3. The Procrastinators. Procrastinators babies want nurse until the milk comes. They can't be bothered while nursing until the milk comes in. They are not interested in more colostrum. These babies should not be given bottle or formula. Conclusion. Continue feeding whenever they are alert. Don't let these dilly-dalliers fool you. They may sleep a lot, take quick sucks, and show fewer signs of hunger, but procrastinators need extra attention so that you can be sure they're getting enough nutrition. These babies need to be at your breast every other hour or at least 8 to 12 times a day so they get the chance to put some practice in. You can also check whether your babies are eating enough by taking a look at their nappies and their weight. Dr. Jane Morton from Stanford University says, a reliable sign of a well breastfed baby is a bright yellow, seedy bowel movement by day 5. And, while all babies lose a few pounds early on, they should be back at their birth weight in around 10 days. Number 4. The Gourmets. For these little connoisseurs, it's not just about feeding, it's a whole experience. They love to play with the nipples, savor the milk, and indulge in a bit of lip smacking before getting down to business. Insists on playing with the nipples, tasting the milk first and smacking their lips before digging in. If hurried or prodded, they scream in protest. After a few minutes of playing, they settle down and nurse. It may take a while, but they're actually encouraging milk production this way as well. Once these babies get a good latch going and are cheerfully smacking their lips, make sure you're comfortable and settled in. Turn up the TV, grab a good book, and maybe have a snack for yourself while you're at it. Your baby is happy and relaxed, so you should be too. And finally, number 5, the resters. These babies have their rhythm, nursing for a while, resting, and sometimes even falling asleep on the breast, only to wake up and continue their feeding journey. Some fall asleep on the breast, then wake up and feed again. With these frequent but short feeding sessions, resters are hungry all the time. But, you definitely don't want to rush your cozy baby and risk crankiness and stress for you both. Instead, try to keep these newborns alert by undressing them, gently nudging them awake, or squeezing milk into their mouths to remind them it's time to eat. Switching to whichever breast feels fuller can also help you ensure that your baby is getting enough nutrition. Conclusion. It's important to remember that every baby is different, growing, and changing. Your baby could go from one breastfeeding personality to the next or show a whole new range of nursing traits as well, before they get the hang of it. Still, what matters most is that you understand what your baby needs from you and what suits you both. After all, these one-on-one moments are great for getting to know your babies and for learning to be the best mom for them. That is all for this video. We thank you for watching this video. Also, do not forget to watch our next video. If you find this video helpful, then do not forget to like, share, and subscribe to Women's and Baby Care. And leave a comment below about how you feel after watching this video. See you in the next video. Till then, ta-ta, goodbye, sayonara, and take care.